Welcome to Rollins College Benefits Presentation. This presentation will review our benefit plans and prepare you for your benefits enrollment. All new employees are encouraged to review the information in this presentation carefully and thoughtfully. Rollins College is a member of ICUBA, Independent Colleges and Universities Benefits Association. As a member of ICUBA, we've collaborated with 27 other colleges and universities to purchase our benefits. Rollins College currently has approximately 700 benefits-eligible employees. If we were to purchase our insurance on our own, our costs would be much higher. Through our collaboration with ICUBA, we present as a much larger population of employees obtaining benefits. Our benefit plan year begins April 1st and ends on March 31st. As a new employee, you are eligible for benefits the first of the month following your hire date. For example, if you are hired on February 5th, your benefits are effective March 1st. New employees must enroll for their benefits within 30 days of their hire date. Once your benefits have been selected, your choices remain in effect through the plan year. If you have a need to change your benefits during the plan year, you may do so for the following reasons: marriage, birth, adoption, divorce, gain or loss of coverage. These changes must be made within 30 days of the event. The deadlines for both enrollment and life events are federally mandated and cannot be altered. Eligible dependents include spouse, domestic partner, and children through the end of the calendar year they turn 26. Important news. As mentioned on our previous slide, our annual plan year begins April 1st and ends March 31st. This means that right now we are very close to our new plan year. As a new hire during the period of February 1st through March 31st, when you enroll for benefits, keep in mind that you are making elections through March 31st. Once you've completed your enrollment, you will be prompted to begin a new enrollment for the new plan year beginning April 1st. It is very important that you complete both enrollments. Following this presentation, please be sure to view our open enrollment presentation located on our Human Resources homepage to learn about the changes for the new plan year. Enrollment in the ICUBA Medical Plan includes pharmacy and behavioral health benefits. Blue Cross Blue Shield administers our medical benefits, Optum Rx administers our prescription drug benefits, and Aetna Resources for Living handles our behavioral health, substance abuse, and EAP benefits. These three carriers will coordinate your medical care needs. The provider for our medical plan is Blue Cross Blue Shield. Rollins is covering 63% of the cost of the insurance, and it includes both in-network and out-of-network coverage. This plan also includes a college-funded health reimbursement account, also known as HRA. We will discuss the advantages of the HRA later in our presentation. We are pleased to offer two medical plans. Both plans are unique in that the deductible does not apply to any office visits, as well as several other services. The first plan we will discuss is the Preferred PPO Medical Plan. The deductibles for this plan are $2,500 single, $5,000 family. The co-insurance is 20% for in-network services. As you will note, all services conducted out of network are more expensive. We have a very large network of providers and encourage all employees to remain in-network. All visits to the doctor for preventative measures are covered 100%. When a need arises to go to the doctor with a symptom, you'll be responsible for paying the 20% coinsurance, no deductible. All lab work is covered 100% as long as it is processed through Quest Diagnostics. The out-of-pocket maximum for this plan is $4,000 single, $8,000 family. Our next plan, known as the $4,000, $8,000 deductible plan, has a higher deductible, higher coinsurance, and higher out-of-pocket expenses than the Preferred PPO plan. The plan has a $4,000 individual and $8,000 family deductible and larger out-of-pocket maximums. The premium will cost less than the Preferred PPO plan, which we will discuss in a future slide. Let's pause for a minute and take a look at this in-network plan comparison. Please note that this only shows in-network benefits for each plan. The plans look very similar in design, but the cost differences can be significant. You'll see that some services on the $4,000, $8,000 deductible plan are a flat copay, which may cost more than the coinsurance on the preferred PPO plan. Please pay close attention to the cost of the services your family will use the most. It is important to remember that the deductibles on both plans do not apply to many visits. Here you will see over 30 common services that do not require that you meet the deductible, but rather you just pay a coinsurance or copay depending on the plan you select. Once again, under both plans, the deductible only applies to certain services, including those that you see here. This means you will have to pay 100% until you reach the deductible before the plan will pay for any of these claims. Blue Cross Blue Shield provides Blue Distinction Total Care providers in their network. If your physician is a Blue Distinction Total Care provider, all of your office visits to this physician are covered 100%, whether you are going for preventative services or reporting a symptom. When you are choosing your provider on the Blue Cross Blue Shield network, you may filter your search by Blue Distinction Total Care doctors. Not feeling well? Unable to get an appointment with your primary physician? Sick while traveling? Call Teladoc. Teladoc allows you and your covered family members the opportunity to speak with a licensed doctor and get treated for simple ailments and acute conditions. A Teladoc visit only costs $5 and is an eligible HRA expense. Be sure to register in advance at teladoc.com or call 1-800-TELEDOC. If you need to see your physician in person, you have several options available. Your primary care physician should help you manage your health and ongoing medical conditions. Convenient care clinics such as those in Walgreens and CVS stores are staffed with medical professionals who can diagnose and treat various acute conditions as well as provide flu shots. Urgent care facilities can also be used for such conditions but will have a higher cost. And emergency room visits are the most expensive and should be used for life-threatening conditions. Surgery Plus is a surgical concierge benefit which focuses on medically necessary, non-emergent surgical cases. Surgery Plus will waive your coinsurance and deductible related to your surgery. We know the surgery process can be overwhelming and stressful. With the help of Surgery Plus, your dedicated care advocate will manage the entire procedure, including helping you select the right surgeon, coordinating travel, scheduling appointments, and managing medical expenses. Surgery Plus takes care of it all with a distinct group of high-quality surgeons of excellence. Here you see some of the surgical procedures that are covered by Surgery Plus. Earlier in the presentation, reference was made to the Health Reimbursement Account, or HRA. This account is fully funded by the college. When you select medical coverage, you will be sent an IQUBA MasterCard. At the end of each month, funds will be loaded onto the card for you and any covered dependents to use towards health-related expenses not covered under insurance. The funds that are placed on your card, if unused, will roll month to month and year to year. Think of it as a long-term health savings account. If you remain on the medical plan for a minimum of 3 years and you were to leave Rollins, the funds will remain with you. A small fee is charged monthly for administration of the card. If you leave Rollins prior to 3 years on the plan, any funds remaining would be forfeited. Your HRA funds may be used to cover out-of-pocket expenses related to your medical, dental, and vision needs. For example, prescription copays and over-the-counter medical supplies. You may even buy your sunscreen, broad spectrum 30 SPF and above, with your HRA funds. The IQUBA portal includes a list of all eligible items. Our Blue Cross Blue Shield plan comes complete with an Essential Advocate. If you require assistance with any of the services on this slide, the Essential Advocate will be happy to assist you. Let's take a look at the premiums for our first plan, the Preferred PPO. For our employees paid on a monthly basis, the first table reflects the monthly premiums. For our employees paid on a biweekly basis, the second table reflects these premiums. Let's look at the first table as an example. Coverage for employee only shows a total premium of $660. The employee cost is the bolded amount of $244.20 because Rollins is covering 63% of the cost, which equates to $415.80. The monthly amount of HRA funds that will be deposited is $125. Rollins will continue to fund your HRA account each month that you are enrolled in the IQUBA medical plan. This means you can receive between $1,500 and $2,100 in your HR account each year. Here are the premiums for the $4,000, $8,000 plan that has the higher deductibles and out-of-pocket maximums. The rates for employee and employee plus spouse tiers are not much less than the preferred PPO plan, but there is savings in the employee plus child and employee plus family tiers. You will need to carefully consider if the higher deductibles and out-of-pocket limits are worth these premium savings. As a member of Blue Cross Blue Shield, we're able to offer a wonderful well-being program called Rally. You are rewarded for taking good care of yourself. When you have a wellness exam performed, and remember it's covered 100% on our plan, and your doctor submits your claim, $60 will automatically be loaded to your Rally account. If you attend an on-campus Rally event, you will receive $10. Testing, including mammogram and colonoscopy, earn $50 in Rally dollars. What are these Rally dollars? They are dollars that can be converted to gift cards to include Amazon, Target, Walmart, Southwest Airlines, and more. You have the opportunity to earn up to $270 in Rally dollars this plan year. It's an easy program which only requires the setup of your account and a survey. After that, the dollars drop in automatically. A bonus to this program are coins. Coins are earned as you partake in different online missions on Rally, as well as private sweepstakes. Be sure to set up your Rally account and begin earning dollars. The Rollins Wellbeing Committee is pleased to offer many programs for our employees right here on campus. Most of the programs are Rally eligible. Rollins Wellbeing focuses on 6 dimensions of well-being: physical, intellectual, financial, social, emotional, and environmental. This slide shows an example of some of the programs that have been offered. We welcome participation in an annual walk or run event. This past year, we participated in the Winter Park Road Race. Our team had a great time. You can see our team sporting their Rollins Wellbeing shirts in the center picture. The Rollins Wellbeing Committee works hard to bring fun yet educational programs to assist you with your 6 dimensions of well-being. Be sure to check out their site, Rollins Wellbeing. Along with enrollment in the Blue Cross Blue Shield medical plan, prescription drug coverage is included and is administered through Optum Rx. If you take a medication on a regular basis, you may want to consider the 90-day option as it provides significant savings to your copay. IQUBA provides a pharmacy advocate program for our covered members. This program is staffed with real pharmacists designed to assist our employees with questions related to their medications. The IQUBA Cares team is dedicated to reviewing your prescriptions, educating you on drug interactions, and offering suggestions on brands available, which may result in savings. Our dental plan is currently provided through Humana. We offer 3 different plans. The Humana coverage will end March 31st, and we will be welcoming our new dental provider, Delta Dental. Please be sure to check out the highlights of the new Delta Dental plans by viewing the open enrollment presentation located on our Human Resources website. The DHMO plan is only available in Florida and only offers in-network coverage. This plan offers no deductible or plan year maximum. It covers cleanings, basic and major services, as well as orthodontia. This plan does have a smaller network of doctors. It includes offices such as Sage Dental and Greenberg Dental, or group practices. It has fewer independent dentists. This plan is of no cost to employees. Premiums will apply for added dependents. The Preventative Plus plan opens a much larger network of dentists and includes more independent practices as well as out-of-network benefits. This plan is only for preventative care. It includes 2 cleanings per year and basic services. Major services and orthodontia are not included on this plan. The PPO High Option plan also offers a much larger network of doctors and out-of-network coverage. This plan covers all preventative care, basic and major services, and orthodontia. This plan includes an additional 2 cleanings per plan year for a total of 4. These are the premiums for each dental option. Remember, the DHMO dental option is of no cost for employees. Our vision coverage is administered through iMed and offers an array of benefits within a large network of providers. Eye exams are only a $5 copay. The plan provides a $130 allowance on frames per plan year and low copays on lenses. Many independent providers are available, as well as larger practices such as LensCrafters and Target Optical. iMed provides additional discounts on LASIK services, discounts on sunglasses through Sunglass Hut, and discounts on contact lenses through Contacts Direct. In addition to the HRA funded by Rollins, you may also participate in the Healthcare Flexible Spending Account. This account allows you the opportunity to contribute via payroll deductions up to $2,750 for this plan year on a pre-tax basis to pay for eligible medical, dental, and vision expenses. These funds are subject to the use it or lose it rule. If your funds are not spent by June 15th, you will lose them. Unlike the HRA, these funds do not roll over. If you elect to contribute to the FSA account, these funds will also be loaded onto your ICUBA MasterCard. When using your card, the system will draw funds from your FSA funds first, as it knows these funds will not roll over. Plan carefully when selecting this account. The Dependent Care Flexible Spending Account is available to families needing care for their dependent children under the age of 13 or for physically or mentally challenged adults unable to care for themselves. This account allows you to contribute up to $5,000 per family per year on a pre-tax basis. This account, like the Healthcare Flex Spending Account, is subject to the use it or lose it rule. Again, plan carefully when selecting this account. This chart reviews the differences between the HRA and the FSA accounts. Life insurance equal to 2 times your annual salary is provided by Rollins at no cost to you. This insurance is administered through Symetra. All plans are portable or convertible upon leaving Rollins. If you are interested in additional life insurance over the amount Rollins is providing to you at no cost, you may elect voluntary life insurance. You may do so in $10,000 increments up to 7 times your annual salary with a maximum of $500,000. Voluntary life insurance is guaranteed to be issued up to $150,000. If selecting coverage over this amount, you'll be required to complete an evidence of insurability form with Symetra. You may elect voluntary spouse life insurance up to 50% of the amount of voluntary life insurance you've selected on yourself. Child life insurance is available up to $12,500. Options to port or convert coverage are available upon leaving Rollins. Our Employee Assistance Plan is administered through Resources for Living and provides services for all active employees and their household members, even if they are not covered on your medical plan. Resources for Living offers many different options to assist you with legal, financial, life, and emotional needs. Counseling is available for each member of your household and includes 6 sessions per person, per issue, per plan year. You may call the EAP for anything, emotional support and counseling, to lifestyle referrals, including legal services, financial planning, or even just needing a local resource to watch your dog or mow your lawn. You may seek the services of an Employee Assistance Program counselor without leaving your home or work. Talkspace allows you to have a visit with a therapist remotely via the web or mobile app. You can send text or audio messages and hear from your provider within 1 workday, and about 1 week of messaging equals 1 EAP session. To establish with Talkspace, begin by calling Resources for Living for authorization. You must be 18 years of age or older. All visits are confidential. If you have the Blue Cross Blue Shield medical plan, you are also enrolled in Aetna's Behavioral Health Program. The Behavioral Health Program is for longer-term professional counseling and psychiatric treatments beyond the 6 free counseling sessions you can receive through the EAP benefit. These items are always free to ICUBA members for in-network benefits. It is important to note that lab tests which are not sent to Quest Diagnostics will be subject to coinsurance, but the deductible will not apply. If you prefer free lab tests, make sure your doctor sends your labs to Quest Diagnostics or visit a Quest Lab center to have your blood work performed. You can even make appointments in advance through the Quest website. Your benefits enrollment must be completed within 30 days of your hire date. To enroll in your benefits, please visit ikubabenefits.org. When visiting ikubabenefits.org, you will see this screen. Your login information is located in the lower left corner of the screen. Your iKuba login will always be your first initial, last name, and last 4 digits of your Social Security number. Your default password is your date of birth. You will be prompted to create your own password. Once you've logged into iKuba, you will see a screen welcoming you to your enrollment. Click the Start Your Enrollment button and the system will walk you through the process. One of the first screens you will see in your enrollment is your personal information. Please be sure your address is correct, as this is where your ID cards for the various plans will be mailed to. Once you've completed your enrollment, be sure to either email a copy or print a copy of your confirmation for your records. If you are not prompted to print a confirmation, your enrollment is not complete. The Rollins 403(b) retirement plan is administered through Voya Financial. Rollins automatically provides all employees a 7% contribution, whether or not the employee is contributing to the plan. You will be vested in the Rollins contribution upon reaching 3 years of service. You may also contribute to your retirement by electing your contribution on the Voya website. Go to rollins.voya.com. Contributions to the plan may be changed as often as every payroll. Would you like to speak with a Voya representative about your retirement? A Voya advisor is available for a 30-minute one-on-one meeting. This is a great way for you to learn more about the plan and prepare for your future. Emails are distributed regularly from Human Resources on how to sign up for a meeting with a Voya advisor. One more reminder, remember you must enroll for your benefits within 30 days of your hire date. And remember, as a new hire, during our open enrollment time frame, you will be completing 2 enrollments, one for the remainder of this plan year through March 31st, and the other for the new plan year beginning April 1st. Questions about our benefits? Please visit our Human Resources website where you will find a wealth of information. And as a reminder, be sure to check out the open enrollment information for the 2021-2022 plan year.